Hello, everybody. This is Betsy Wurzel, host of Chatting with Betsy on Passionate World Talk Radio, where we educate, enlighten, and entertain. And I certainly do get educated by my guests, learning so much. And I want to thank Jeannie White for producing the show, writing the blog, and I'm thanking Lillian Caldwell, CEO, for having Passionate World Talk Radio. Folks, you need to listen to this podcast because I'm sure you've heard in the news about long haulers from COVID and what they are experiencing. Now, I want to put a disclaimer here. This is not medical advice. I want you to always consult and talk to your physician, always. And I have with me today one of my most fabulous guests. I want to thank Dr. Arthur Wernick for coming on. He is a clinical pharmacist and an expert in medication therapy management. And if you need help with your medications and medication management, I highly recommend you contacting Dr. Arthur Wernick. Thank you, Arthur, for coming on with, I know, valuable information.
Good morning,
Thank you.
Betsy. It's a pleasure to be here with you and your guests.
Thank you. Thank you. So, Arthur, we hear in the news, this is what I've read, okay? Long haulers.
Yeah.
They are having memory problems, just what we don't need, right? Lung issues. They're having like respiratory issues. They're having depression, anxiety, post-traumatic, blood clots some people are having. So please, I can't wait to hear your information.
Well,
go ahead.
There's an array of symptoms that patients have, that's for sure. I always like to begin by trying to define the terms. Of course, we're talking about long haulers. It's also, another term that's also used is long COVID. So I think I may use those interchangeably, long haulers and long COVID, meaning the same thing. So right about now, we're a year into COVID. And all this information is evolving. But about 6 months ago, when COVID was only about 6 months old, long haulers were loosely defined as patients having symptoms with no sign of the virus. They were testing negative, and they were 3 to 6 months out from the initial infection. So what they had found that 3 months out from the initial infection, 50 to 80% of patients had some bothersome symptoms still. So in an effort to create a finer distinction, it's presently defined as patients who are 6 months after infection with no detectable virus. It affects about 10% of all patients who have the virus.
Very interesting. So not everybody is a long hauler. We just want to put that out there.
Yeah, that's why they wanted to make a distinction. They found that it was very common for patients to have symptoms up to 3 months later. It was when it became 6 months out and there was a distinct set of patients that had quite a variety of symptoms that they decided that is the segment of the population that they were going to call long haulers or long COVID. And as you mentioned, there are an array of symptoms. I've got about probably 15 here. I'm going to go down the list, and a lot of these symptoms are common for people. Some have 2 or 3 symptoms. Some have more than a half a dozen different ones. But here's the array. And number 1 is fatigue. That is by far the most common symptom of patients that are long haulers. Patients have confusion, lack of concentration, brain fog, they're forgetful, they become dizzy, muscle aches, joint pain, shortness of breath, a lingering lack of taste and smell, nausea and diarrhea, insomnia, increased heart rate, chest pain, temperature spikes, cough and congestion, and more recently, swelling of the legs. I also read a report of a patient having vivid dreams. So that was a little bit new, but that is what we're hearing. Now, in an effort to maybe delineate this even further, an author, Don Goldenberg, just published a book entitled How the COVID-19 Pandemic is Affecting You and Your Healthcare. He proposes that there are 3 subsets within the long hauler population. So the first group in this subset are patients who are critically ill, they were in ICU, and they do have permanent organ damage, primarily to the lungs. The second subset are patients that had the range of mild to severe COVID and had some organ damage as well, primarily to the heart and the brain. The third subset makes up the majority of patients, and this again is up to 10% of all patients that had COVID. They have no infection, they test negative, they have no sign of organ damage or diminished organ function. They might even have a normal physical exam and normal lab work, but they do have multiple symptoms.
Wow, that's a lot of symptoms. That's, what scares me, Arthur, about this virus, and not that I live in fear every day of it, but it's that, people can have this ongoing for quite a long time. Now, do they know with the long haulers or long COVID how long, or maybe they don't know, how long they would experience some of these symptoms? Like, is this lifelong?
That's interesting. I like to, read the literature. I like to read what they think they know at the present time. But what I also did is that I joined 3 different groups on Facebook. There's thousands of people on Facebook with long hauler groups, 3 different groups devoted to long haulers. And I thought, I need to know what people are also thinking, in addition to the research and the science. And to address your question directly, I'm now starting to read people's experiences that go 10 months and more from the time they had the initial infection. And in some cases, the symptoms are just bothersome. In other cases, they are all of a sudden experiencing new symptoms that they didn't have the first couple months. But yes, it's starting to go 10 months out now, and maybe a little bit more as well.
Oh, that's really something for people to think about, and especially why it's so important. I really want to emphasize this, and I'm not political, but folks, you need to wear your mask. I mean, you have to wear it. It's, you have. It's not against your rights, okay? And especially now, and this could be a whole different show. Now they had that variant strain that's arrived. I live in New Jersey. It's in New York already. It's only a matter of time before it comes over here. And, you could be a carrier and not know it, which is what really scares me. Makes me paranoid.
Yeah, well, that strain is considered so far to be easier to spread. I don't think there's any firm data that says that it's a more severe infection, but it's easier to transmit. And I don't even know.
Right.
Uh-huh.
Yeah, go ahead. I even heard that it was real quick on the news. This is probably a couple of weeks ago, that the mask may not even be able to prevent this variant strain from infecting somebody. And now they're recommending people to wear 2 masks. I could barely breathe with 1 mask on, but I always wear a mask wherever I go.
Well, the thinking was with the type of masks people have been wearing up till now, that there's a reasonable chance to expect that it reduces the chance of transmitting the virus by about 50%. If you have a virus that is more transmissible, it makes sense that that number would drop in the presence of a virus that's easier to transmit. So maybe less than 50% of people are protecting themselves when they have the usual mask that people have been wearing. And now that we have a stronger strain, that may not be as effective. So maybe 2 masks is a good idea.
Right. That's it just blows my mind about this virus. We're, a year into it, and now we have a variant of it, and, it's really makes me kind of nervous. Not that I, like I said, I don't live in fear every day. I go out and about in my life, and I am cautious. But, you just, never know. What are they doing for these long haulers, Arthur? Are they treating them by symptoms, like individual symptoms?
There's a lot going on. It's starting to kick in right now. the key thing that they're focusing on is this feeling of fatigue. There's no question that seems to be the primary symptom that most people have. Now, when I say that 10% of all patients seem to fall in this category of long COVID, that number could be up to 15 to 20%. And we have to remember that all the information is evolving. But once again, with the fatigue, that does have basically a designation. They do have a name for that. It's called post-viral fatigue syndrome. And this was also seen after the 1918 pandemic, 2003 SARS infection, and in 2009 with the influenza A. That fatigue is definitely one of the most common problems that people are having. There's not the treatments, and we'll get to that in a little bit, but the treatments haven't evolved. They don't often even know what they are treating. When a patient has normal labs and says they can barely breathe and their lungs seem to be clear, it's really difficult to know what treatment approach to take. But that's in the works. What they're trying to figure out now is what it is they're dealing with. There's a lot of potential for risk for these patients. They feel that the greatest risk is among patients that are over 50 years old, patients that have 2 or 3 chronic conditions, primarily high blood pressure and obesity, and patients that had severe COVID, but not always. Some patients that had the mild cases also are having long-haul symptoms. It's also interesting to note that about 20% of the long haulers are between the ages of 18 and 34. If you had between
18 and 34.
Yeah,
so they're young.
Yeah, that's right. And yeah.
I was going to say, what about for us older folks, like senior citizens? Do they have a percentage of that?
I don't have the percentages for that, but it's more distributed among patients that are older than that, in their 50s and 60s. But to have about 20% of them being in what we call the category of people that are generally the healthiest of all, strongest immunity, and those kind of things, that's a little bit surprising. Also, they're finding that in a couple of clinics, I read some reports where they say clearly women outnumber men in the population of long haulers. There's one clinic that says they see 4 women for every man that has long haul.
Well, that's interesting.
Yeah.
Different genetic makeup. Yeah.
They're not sure. So the idea is to try to figure out what's causing this. What's bringing this up? They can't get to treatment until they understand what the process is. And so there is some speculation. It sounds a little complicated, but they're trying to figure out why is this happening in the first place? Why is this happening to these patients? And there are a few ideas. Some think that there's a continued low level of inflammation in the brain. It may indicate an overreaction to the immune system, but they think there's still some low levels of inflammation in the brain. They think that maybe there's a diminished blood flow to the brain. And they're also thinking maybe there's a latent, undetected virus. Maybe there's a level of virus that's undetectable that's still present in the body that's causing these problems.
And when I hear inflammation and the brain, I automatically think they say that can cause dementia. The more inflammation you have in your brain, can predispose you to that. So I hope we're not going to have a whole new crew of people getting dementia at a young age, because that would be just awful. Right? That's my opinion.
That may not be a direct relationship. Inflammation in the brain for dementia is caused by initial damage that occurs. There's chemical processes that create damage to the brain, and that damage results in inflammation. So this would be a different path, so to speak.
A different kind of inflammation.
Yeah.
Oh, okay.
Yeah.
Oh, that's a relief. That's a little bit of a relief.
Yeah, it's obviously we're talking about one organ system. The brain is the brain, but it appears to be two very different paths of chemistry, paths of events that occur that eventually cause the condition.
Oh, okay. All right. Well, thank you for clearing that up. That makes me feel, better for the people who can, have that inflammation. Just be interesting to see down the line what their outcome is. Go ahead, Arthur. I'm very interested.
Well, I think it's important to take a closer look at the fatigue, because that seems to be what bothers most long haulers. And what's interesting is that in some cases, the fatigue clearly resembles chronic fatigue syndrome. There's a lot of similarities to it. And I'm going to circle back to that in a second, but this gets very interesting. In data collection from the World Health Organization, most of the persistent effects of the virus were at their worst at the start of the infection and tapered down as time progressed. Even if the symptoms were bothersome, it makes sense. You feel worse in the beginning, and as time goes on, the symptoms diminish. And that's logical. But what's unusual, paradoxically, is that one of the most common long-term effects, which is the confusion and the brain fog, it appears to get worse as time goes on. Now, remember I just mentioned about the fatigue and how it resembles chronic fatigue syndrome. Doctors and scientists are trying to use what they know already to learn more. The fatigue and the brain fog may have a common cause. And this is how it works. Part of our nervous system is called the autonomic nervous system. It controls involuntary functions such as heart rate, blood pressure, breathing, and digestion, things that our nervous system does that we don't consciously think about. Malfunction of the autonomic nervous system is called dysautonomia, and it is a recognized syndrome. Now, an additional and seemingly separate form of dysautonomia is called POTS, P-O-T-S, and that stands for postural orthostatic tachycardia syndrome, the hallmarks of which are also fatigue and confusion. So the suspicion is that POTS, chronic fatigue syndrome, and long COVID may all be one and the same.
That's interesting. And fatigue is very difficult to live with, to function. People don't know what it's like. I know what fatigue is like because I have fibromyalgia. I don't have chronic fatigue, but the fatigue that I have is bad enough. I wouldn't want to add, more to it. So these people, are they able to function in their daily living and their going back to work? Do they know if they're able to function?
It varies. The fatigue is persistent. And one of the things that, again, reading what's going on with real people, is that it's throwing off their sleep and wake cycles, number one. And that could be very disorienting to a healthy person. So their sleep and wake cycles are really altered. And that begins to change everything else. It's almost like a bit of a downward slide. So where some of the symptoms like chest pain or temperature changes kind of come in spikes, the fatigue could be chronic. We'd rather call it chronic fatigue. So that can be difficult for a patient because it does alter everything else the way they feel.
Right. Right. And if people...
This is why they're focusing on.
Yeah, and people don't understand, Arthur, that when it's not something that someone can snap out of it. It's not that they're lazy, because sometimes people go, oh, you're just lazy, or, you're not motivated. No, when you are so fatigued, it's not, it's a chemical. It's something going on in your body that we can't control. This is very important to bring up, because a lot of people might think, why am I so tired? Why do I feel this way? And, this is why, if you feel like that, please consult your physician always. Go ahead, Arthur.
Yeah, this is why they're taking such a close look at it. It's pervasive among long haulers, and there's no direct reason why it's happening. So, again, a lot of these reasons are what they think might be going on. And, again, they're trying to use what they know to gain more information. And if it works out that they find precisely what's causing the fatigue, then the therapies will be a little bit more targeted and be more effective. But right now, they're really not sure. When they have normal scans, but they have symptoms, that becomes a confusing area. So the thick of the studies right now are in what's causing this. What is it and what's causing it? And then the treatments would evolve from there. It's interesting that in early December, the National Institute of Health had a 2-day conference that was dedicated to long COVID. And their conclusions were this: the condition needs to be recognized as a syndrome and given a name. It needs to have a system of diagnosis, and it needs treatment. Now, you don't want treatment to be the last thing that they can do, but it has to go from A to B to C. And so we're really in the position of trying to determine how this is happening and how to diagnose it. And people are using inhalers for the respiratory symptoms. They seem to be working, but it doesn't seem to be causing the symptoms to dissipate and go away.
Wow. So they will have to come up with more treatments as they learn more about this long COVID.
Yeah. They will. I mean, for those that don't think they're being taken seriously about their condition, as I said, the National Institute of Health knows about it. The National Institute of Neurologic Disorders and Stroke knows about it. It's being studied at Stanford University, University of California in Davis, Columbia University Medical Center. Articles are being written and published from respected medical journals such as the Journal of the American Medical Association, the British Medical Journal. I mean, even Dr. Fauci knows about it. This is an area of concern, a big concern, because chronic illness it takes a toll on society, it takes a toll on the individuals and on society. We have enough chronic illness to know that now. And they don't want to see another potential chronic illness being part of the population.
Yes, that's definitely for sure. And, the only thing, Arthur, that I guess we could encourage people is to still, be cautious. And I really want to tell people, even if you get a vaccination, you still need to wear that mask. Some people might think, oh, I'm getting vaccinated. I'm okay. I don't need to wear a mask. Yes, you still need to wear a mask. Be considerate of other people, please.
That information is evolving now that the vaccinations are starting to be administered. Originally, they thought you need to be, it might take up to a week to gain some protection from the first shot. Now we're starting to hear from some clinical sources that you shouldn't trust the protection of the vaccine until a week after the second shot. So you're talking close to a month or maybe a little longer from the first shot to when you actually have protection. And as is apparently known, even if you have antibodies and you are protected from getting the virus, you can still inhale it and harbor it in your sinuses and transmit it. It's not known for how long that you can do that, but you can still breathe in the virus. And it still may be active for some number of days, some period of time. They're actually trying to develop some of the vaccines that are still in development. They're trying to measure what kind of concentration of protection is in the nasal passages to see if once somebody inhales the virus, that maybe it would become instantly killed once it becomes inhaled.
You are so fantastic, Arthur. You are just a wealth of information, and I want to thank you for coming on and making people aware of what they call long-term COVID or long haulers. This is great information for people who, if they think they are experiencing any of these symptoms, please always consult your physician. I can't say it enough. This is just making you aware of symptoms, but your physician is the one to go to. Dr. Arthur Wernick, where can people get in touch with you if they want to learn about what you do?
Well, the two easiest ways are email and telephone. So my email is arthurwernick@gmail.com, ARTHURWERNICK as one word, @gmail.com. And my phone number is 802-345-8804.
Thank you. Thank you, Arthur. I appreciate you coming on. And folks, you're welcome. Take this information, share it. You can hear this podcast again wherever you hear your favorite podcast. It's free to subscribe to Chatting with Betsy on all the podcasts, Apple, Google, wherever you hear it. And you will hear information important that is given out by guests like Arthur Wernick and other guests. This is what my show is about, is to provide resources and to help other people. I want to thank you again, Arthur, and thank you, listeners, for listening, and appreciate your support. Please, people, wear a mask, and please be kind. Until we chat again, this is Betsy Wurzel, host of Chatting with Betsy, a Passionate World Talk Radio. Bye now.